Okay, and the time now is 7:20. You know, aches and pains and a few gray hairs. That's normal as we age, but there are some signs associated with aging that are not usual and should be treated immediately. Here to tell us more on this, Dr. Joshua Groetsch, a physician from People's Health. Good morning. Thank you for coming in. This is a really important topic. And, you know, so many people just think, you know, it's just a normal part of aging. And for example, one of the key things is eyesight and vision. You know, what are the things that you start feeling that you shouldn't ignore?
Well, a lot of times people feel that, you know, with age, things are going to get worse, and losing my vision or my vision getting worse is a normal consequence of aging. But the reality is, with appropriate screening, appropriate treatment, some of those conditions either can be prevented or even stabilized if they can't be prevented from getting worse. As you get older, it's not uncommon to hear someone say that suddenly their vision seems more blurry than they were in the past. They tend to complain that their night vision's worse. They tend to complain that maybe colors don't look as vivid as they used to, or they may get a lot of light sensitivity or glare. The most common causes of vision issues when you get older are in mainly two categories. Cataracts are the most common cause of reversible vision loss. And that's a reversible vision loss in one category. The other one would be irreversible vision loss, where you have things such as glaucoma, age-related macular degeneration, and diabetic retinopathy. Those are things that, unfortunately, as they start to cause vision problems, they cannot necessarily be reversed, but they could be stabilized, assuming you're getting appropriate treatment.
So blurry, pain in the eyes, flashes of light, which are the symptoms would you say, if a patient were to tell you that you would say, that's it, that's okay, but that one you got to go and see someone?
Well, you know, blurred vision in general should just be evaluated, because most of the time it's going to be something benign that's not of any serious consequence. However, blurred vision with association of suddenly floaters, flashes could signify retinal problems. The development of halos or a noticeable loss in peripheral vision could signify the development of glaucoma. Glaucoma is important because you don't necessarily know you have it without screening, so that's why screening becomes important, because many of the symptoms that you get from glaucoma don't occur until late in the game. When you have macular degeneration, which is the leading cause of blindness in America, basically, over the age of 65, that generally can cause a loss or decrease in your central vision and a kind of a distortion of central vision, where straight lines suddenly become wavy.
And, you know, as you age, you want to maintain your independence, and that means you want to continue driving. But what are the signs that maybe, I think it's time for me to stop driving, or for you to tell your loved one it's time to stop driving?
So, you know, obviously if your night driving or your night vision becomes an issue, that's going to make it more difficult to be on the road safely at nighttime. Blurriness in general, you should just get that checked out and evaluated, because there's certain criteria for every state. It varies a little bit from state to state, but there's certain criteria that when your vision gets below a certain level, you're really legally not supposed to be driving. So anytime you have a drop in your vision, you have to get evaluated, and if that drop is significant enough, you're technically kind of required that you should notify the DMV, because you should not be on the road driving when you've had a certain degree of vision loss or a certain degree of peripheral vision loss.
And how regularly should you be getting your eyes checked as you age? My last question to you.
So generally every 1 to 2 years is what I recommend. Really beyond the age of beyond the age of 60, every year is a good check, because many of those conditions that we talked about that are irreversible can kind of develop over the course of several months to a year's time. So yearly intervals is good at that point to make sure none of those issues are developing, so you can stop them in their tracks before they get worse.
Yeah, and that's the key thing, getting to everything before it gets worse. Thank you so much, Dr. Groetsch, physician from People's Health. Thank you so much for coming in this morning. Much appreciated.
Thanks for having me.
Thanks.